I actually couldn't stop. My body was craving opioids, and I needed help.
Andrew is a 21-year-old college student from Pennsylvania. When he was 16, a friend gave him some prescription painkillers. Soon, Andrew found he couldn't stop.
I'm your typical average kid growing up, athletic, soccer. My mom was the soccer mom. I've been athletic my whole life, never thinking that I could be addicted to a substance. Started, twice a week, 3 times a week. Then it just became daily, and it was constantly on my mind. It's like it took over me. My parents and my sister knew something was up. They didn't know I was lying, stealing, doing everything bad.
Always store Suboxone film safely out of the sight and reach of children. Accidental ingestion by a child can cause serious breathing problems that could result in death.
I thought I could stop whenever I want, and actually it just got worse. It really just got worse. I knew I had a problem when I was on City Avenue driving, just feeling so down, feeling like crap, and just really hit me hard that I needed to change my life. I started breaking down, and my parents were so happy that I was able to come out and say exactly what was going on and that I needed more help. It felt great to just let it all out, and being completely honest. Suboxone helped. There's really no words to describe how much it's helped me.
As a narcotic medication, Suboxone film can cause physical dependence. Suboxone film is available only by prescription. It is illegal to sell or give away your Suboxone film.
The first time my doctor gave it to me, my body wasn't aching. I didn't have that feeling of when am I going to get the next opioid. It takes the cravings away. However, there are other things you need to do. Surrounding yourself around the right people, group therapy, it's a lot more than willpower.
Andrew had been in treatment with Suboxone tablet. At his doctor's suggestion, he switched to Suboxone film.
So the Suboxone film is so much more convenient than the tablets. For example, just putting it in my wallet for the day, placing the film right under your tongue, and it melts right away. And the taste doesn't linger. With the tablet, it took like 5 or 6 minutes. I would have to have some type of candy after just to get rid of that taste. I choose the film. Hands down, the film.
People who have taken buprenorphine, especially by injection, and in combination with benzodiazepines or other central nervous system depressants, including alcohol, have suffered serious breathing problems and death, and should always be monitored by a physician.
Suboxone in my life made a huge difference. Now I'm able to focus on my education, my career. I want to have a life, have a family. I ultimately want to leave a good footprint in my life.
Important safety information. Suboxone, buprenorphine, and naloxone sublingual film C3 is indicated for maintenance treatment of opioid dependence as part of a complete treatment plan to include counseling and psychosocial support. Treatment should be initiated under the direction of physicians qualified under the Drug Addiction Treatment Act. Suboxone, buprenorphine HCl, naloxone HCl dihydrate sublingual tablets, C3, is indicated for the treatment of opioid dependence. Suboxone sublingual film and Suboxone sublingual tablets should not be used by patients hypersensitive to buprenorphine or naloxone. Suboxone sublingual film and Suboxone sublingual tablets can be abused in a manner similar to other opioids, legal or illicit. Clinical monitoring appropriate to the patient's level of stability is essential. Chronic use of buprenorphine can cause physical dependence. A sudden or rapid decrease in dose may result in an opioid withdrawal syndrome that is typically milder than seen with full agonists and may be delayed in onset. Suboxone sublingual film and Suboxone sublingual tablets can cause serious life-threatening respiratory depression and death, particularly when taken by the intravenous IV route in combination with benzodiazepines or other central nervous system (CNS) depressants such as sedatives, tranquilizers, or alcohol. It is extremely dangerous to self-administer non-prescribed benzodiazepines or other CNS depressants while taking Suboxone sublingual film or Suboxone sublingual tablets. Dose reduction of CNS depressants, Suboxone sublingual film and Suboxone sublingual tablets, or both when both are being taken, should be considered. Liver function should be monitored before and during treatment. Death has been reported in non-tolerant, non-dependent individuals, especially in the presence of CNS depressants. Children who take Suboxone sublingual film or Suboxone sublingual tablets can have severe, possibly fatal respiratory depression. Emergency medical care is critical. Keep Suboxone sublingual film and Suboxone sublingual tablets out of the sight and reach of children. Intravenous misuse or taking Suboxone sublingual film or Suboxone sublingual tablets before the effects of full agonist opioids, for example, heroin, hydrocodone, methadone, morphine, oxycodone, have subsided, is highly likely to cause opioid withdrawal symptoms. Neonatal withdrawal has been reported. Use of Suboxone sublingual film or Suboxone sublingual tablets in pregnant women or during breastfeeding should only be considered if the potential benefit justifies the potential risk. Caution should be exercised when driving vehicles or operating hazardous machinery, especially during dose adjustment. Adverse events commonly observed during clinical trials and post-marketing experience for Suboxone sublingual tablets are headache, nausea, vomiting, sweating, constipation, signs and symptoms of withdrawal, insomnia, pain, and swelling of the limbs. Adverse events commonly observed with the sublingual administration of Suboxone sublingual film are numb mouth, sore tongue, redness of the mouth, headache, nausea, vomiting, sweating, constipation, signs and symptoms of withdrawal, insomnia, pain, swelling of the limbs, disturbance of attention, palpitations, and blurred vision. Cytolytic hepatitis, jaundice, and allergic reactions, including anaphylactic shock, have been reported. This is not a complete list of potential adverse events associated with Suboxone sublingual film and Suboxone sublingual tablets. Please see full product information for a complete list. To report an adverse event associated with taking Suboxone sublingual film or Suboxone sublingual tablets, please call 1-877-782-6966. You are encouraged to report adverse events of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.